Hey everyone, Ali here again. So let's talk about something called retaliation with whistleblowers. So when you think about whistleblowing, you really think about like the largest companies, right? Like someone's whistleblowing at, a Fortune 100 company of something really nasty that's happened, or in the federal government. But it happens at the local practice level as well, in a lot of dental medical practices. And so it's important to talk through this. So what does whistleblowing look like in a small business like yours? Well, it has to do with potentially OSHA and HIPAA violations, HR violations, potentially clinical violations, including how you maybe bill for insurances and things of that nature. So if you have employees who are bringing these topics up, these may be valid things. They may not be things you want to hear. They may not be things you want to deal with, but if it's being brought up, then it's something that you have to, deal with as far as the employee is concerned. And what I see a lot is the mistake of someone terminating an employee because of that, or they will reduce their hours, or they will do something else in retaliation for the employee raising these concerns. And sometimes employees raise these concerns out of spite because they're just angry or unhappy or whatnot. But a lot of times they do it because they actually care, right? And they may, if they think you're doing something wrong with an insurance company, a third-party payer, it may not be because they want to cause trouble. It may be because they're concerned about the practice getting in trouble for insurance fraud, as an example. Or if there's an HR issue, they may not be trying to raise trouble, but rather they're trying to bring up topics that they know will get the practice potentially in trouble down the road, and they want to avoid fines and penalties for you. So there's a lot of reasons for these kinds of things, but the worst thing you can do as a practice owner is during one of those complaints, or when those things are brought up to you, to then retaliate against the employee by reducing their hours, changing benefits, terminating them, all those things. So if you have any questions about any of this, if you think something might be a retaliation, potential problem, or a whistleblowing thing, just give us a call, do a consult with us. We'll help you through it. Thanks.